Hello, everyone. My name is Linda, and I'm so happy to see you here today. Welcome to our English lesson. Today, we are going to learn very useful English for the pharmacy. Do you know what a pharmacy is? A pharmacy is a place where you buy medicine. Sometimes we also call it a drugstore. In today's lesson, you will listen to me talking with a pharmacist. A pharmacist is the person who works at the pharmacy and helps you with medicine. Her name is Maria, and she is very nice and helpful. We will practice English that you can use when you feel sick and need medicine. Don't worry if some words are new for you. I will explain everything slowly and clearly. It's okay if you don't understand everything the first time. That's completely normal when you're learning English. Are you ready? Let's begin. First, let's listen to my conversation with Maria at the pharmacy.
Good morning. How can I help you today?
Good morning. I'm not feeling very well. I think I have a cold.
Oh, I'm sorry to hear that. Can you tell me about your symptoms?
Well, I have a sore throat and I'm coughing a lot. My nose is also very stuffy.
How long have you been feeling like this?
It started 3 days ago. First, my throat began to hurt. Then yesterday, I started coughing. Today, my nose is really blocked.
I see. Do you have a fever?
No, I don't think so. I checked my temperature this morning and it was normal.
That's good. Do you have any headaches?
Yes, a little bit, not too bad, but my head feels heavy.
Okay, I think I can recommend something for you. For your sore throat and cough, I suggest these throat lozenges. They taste like honey and lemon.
Throat lozenges? Sorry, what are those exactly?
They are small candies that you suck slowly. You don't chew them. You keep them in your mouth, and they help your throat feel better.
Oh, I understand. That sounds good.
And for your stuffy nose, I recommend this nasal spray. You spray it in your nose, and it will help you breathe easier.
How often should I use the nasal spray?
Use it twice a day, once in the morning and once before bed. Don't use it more than 3 days.
Why only 3 days?
If you use nasal spray for too long, it can actually make your nose more stuffy. 3 days is enough.
Okay, I understand. What about the throat lozenges? How many can I take?
You can have 1 lozenge every 2 hours. Don't take more than 8 in 1 day.
Every 2 hours and maximum 8 per day. Got it. Do these medicines have any side effects?
Side effects are not common with these medicines. The throat lozenges are very gentle. Some people feel a little sleepy with the nasal spray, but that's not very common.
That's good to know. How much do they cost?
The throat lozenges are $6.50, and the nasal spray is $8.99. Together, that's $15.49.
Perfect. I'll take both, please.
Great. Here's your receipt. Make sure to drink lots of water and get plenty of rest. If you don't feel better in 5 days or if you develop a fever, please see a doctor.
Thank you so much, Maria. You've been very helpful.
You're welcome. I hope you feel better soon. Take care.
Thank you. Have a nice day. Now, let's talk about some important words and phrases from our conversation. Don't worry, I'll explain everything very simply. First, let's talk about symptoms. Symptoms are the ways your body feels when you are sick. For example, a sore throat, a cough, or a stuffy nose, these are all symptoms. When I said stuffy nose, I meant my nose was blocked. I couldn't breathe through my nose easily. We can also say blocked nose or congested nose. All of these mean the same thing. Maria asked me, "How long have you been feeling like this?" This is a very common question at the pharmacy or doctor's office. She wants to know when I started feeling sick. I answered, "It started 3 days ago." Another important phrase is throat lozenges. These are small, hard candies that help your throat. You put one in your mouth and suck it slowly. You don't bite it or chew it. Maria said they taste like honey and lemon. This means they have a honey and lemon flavor. We also talked about nasal spray. This is liquid medicine that you spray inside your nose. Nasal means related to the nose, so nasal spray is nose spray. Maria used the word recommend. When someone recommends something, they suggest it. They think it's a good choice for you. So Maria recommended throat lozenges and nasal spray for my cold. Now, let's practice some key sentences from our conversation. Let's practice together. I'll say a sentence, then you repeat it. Ready? I'm not feeling very well. I think I have a cold. I have a sore throat. I'm coughing a lot. How long have you been feeling like this? It started 3 days ago. How often should I use this? Do these medicines have any side effects? Excellent, you're doing great. Let's continue with a few more important phrases. Now let's practice asking about medicine instructions. These are very important phrases to remember. How much should I take? How often should I take this? Can I take this with food? When should I take this medicine? How many days should I take this? Perfect! Now let's practice describing how you feel. Remember, the pharmacist needs to understand your symptoms to help you. My throat hurts. I have a headache. My nose is blocked. I feel tired and weak. I have a runny nose. Wonderful! You're learning so much useful English today. Now I want to teach you some more very useful pharmacy words and phrases. These will help you a lot when you visit a pharmacy. Let's talk about different types of medicine. First, we have tablets. Tablets are small, hard pieces of medicine that you swallow with water. We also call them pills. Tablets and pills mean the same thing. We also have capsules. Capsules are like small containers with medicine powder inside. They are usually easier to swallow than tablets. Liquid medicine is medicine in liquid form, like a syrup. You usually measure liquid medicine with a small spoon. When the pharmacist gives you medicine, they will tell you about the dosage. Dosage means how much medicine to take. For example, take 1 tablet. That's the dosage. Another important word is prescription. A prescription is a paper from your doctor that tells the pharmacist what medicine to give you. For simple things like colds, you don't need a prescription. You can buy the medicine directly. We call this over-the-counter medicine. Let me explain over-the-counter. This means you can buy the medicine without a prescription from a doctor. You can just ask the pharmacist and they can sell it to you. Cold medicine, pain medicine for headaches, and stomach medicine are usually over-the-counter. Now let's practice a different conversation. This time you will hear me ask about medicine for a stomach problem. Excuse me, Maria. I'm sorry to bother you again.
No problem at all. What can I help you with?
I have an upset stomach. Do you have anything that might help?
Of course. Can you describe how your stomach feels?
It hurts a little, and I feel nauseous. I feel like I might be sick.
When did this start?
About 2 hours ago, after I had lunch.
What did you eat for lunch?
I had some spicy food. Maybe it was too spicy for me.
That could be the problem. I recommend these antacid tablets. They help when your stomach is upset from spicy or acidic food.
How do I take them?
Chew 2 tablets slowly. You can take them every 4 hours if you need to, but don't take more than 6 tablets in one day.
Do I chew them? I don't swallow them with water?
That's right. These are chewable tablets. You chew them like candy. They taste like mint, so they're not bad.
Okay, that sounds easy. How much do they cost?
These are $4.75.
Great, I'll take them. Thank you for your help.
You're welcome. Try to avoid spicy food for the next day or two. Drink lots of water, and if you still feel sick tomorrow, please see a doctor.
I will, thank you so much. Let's learn about the new words from that conversation. Upset stomach means your stomach doesn't feel good. It might hurt or you might feel sick. We can also say stomach ache or my stomach hurts. Nauseous means you feel like you might vomit. You feel sick to your stomach. Some people say, I feel sick or I feel queasy. Spicy food is food with hot spices, like chili pepper. If food is too spicy, it can hurt your stomach. Antacid tablets are medicine for upset stomach. Antacid means against acid. So these tablets help when your stomach has too much acid. Chewable tablets are tablets that you chew with your teeth, like chewing gum or candy. You don't swallow them whole with water. Maria said, avoid spicy food. Avoid means stay away from or don't eat. So she's telling me not to eat spicy food for a few days. Now I want to give you some more phrases for different pharmacy situations. If you need medicine for pain, you can say, I have a headache. Do you have anything for pain? My back hurts. What do you recommend? I need something for muscle pain. If you need medicine for allergies, you can say, I have allergies. My eyes are watery and itchy. I need allergy medicine. Do you have antihistamines? If you want to ask about side effects, you can say, are there any side effects? Will this make me sleepy? Can I drive after taking this? Is this safe to take with other medicine? If you need to ask about dosage, remember these phrases. How many should I take? How often can I take this? Should I take this with food or on an empty stomach? Can children take this medicine? Let's do one final practice. I want you to imagine you are at the pharmacy. Practice these complete conversations with me.
Hello, I have a cold. I'm coughing and my nose is stuffy.
It started 2 days ago.
How often should I take this?
Excuse me, I have a bad headache. Do you have anything that can help? How many should I take? Thank you very much for your help. You have done such wonderful work today. You learned so much useful English for the pharmacy. Remember, going to the pharmacy in English might feel scary at first, but pharmacists are there to help you. They want you to feel better, so they will be patient and kind. Today, you learned how to describe symptoms, ask about medicine, understand dosage instructions, and ask about side effects. These are all very important skills. My advice is to listen to this lesson again tomorrow. Each time you listen, you will understand more. Don't worry if you forget some words. That's completely normal when learning a new language. Practice these phrases at home. You can even practice in front of a mirror. The more you practice, the more confident you will feel. Thank you for joining me today. I hope this lesson helps you feel more confident about using English at the pharmacy. Remember, every small step counts in your English learning journey. Take care and see you in our next lesson.